Jenny. Today we're talking about the medication that you were recently prescribed by Dr. Olson, your psychiatrist. So Dr. Olson prescribed citalopram. Citalopram is a type of medication that is meant to decrease your feelings of sadness and depression. This is going to also help with your feelings of anxiety that you've been having. Dr. Olson is starting you out taking 20 milligrams, which is a really common starting point and dosage of medication. You'll be taking the medication 1 time per day, and because one of your symptoms of depression is making you stay in bed and sleep really late in the morning, you'll be taking this medication at night before you go to bed. Citalopram is an SSRI, and that's just one type of an antidepressant. And what an SSRI medication does, or what your medication is called citalopram, what citalopram will do is help the neurotransmitters or messages go from one cell in your brain to the other cell in your brain. So essentially, the medication will help the messages travel where they're supposed to go. SSRIs help with the blocking of one cell, again, so that the message can travel, which essentially will decrease your depressive excuse me, your depressive symptoms excuse me, your depressive symptoms, and again, decrease that anxiety and help elevate your mood. So once that communication process starts to happen, you'll notice changes in your moods, feelings, and your behaviors. Some of the ways that I will know, Dr. Olson will know, and those around you will know that the medicine is working is that in 1 to 4 weeks, sometimes for some people it takes a little bit longer, you will start to feel better. And I want you to be honest with me. You should start to feel more motivated, have more energy, again, not want to sleep in as long, and overall become happier. You'll be seeing Dr. Olson again in 1 month, and if you want me to sit in on that appointment with you, I would be happy to do so. This is a very important appointment for you to attend. At this appointment, you'll be telling Dr. Olson how you felt in the first 6 weeks or so, in the first month. If you start to have side effects like an upset stomach, forgetfulness, problems with your sexual abilities, maybe headaches, nausea, dizziness, weight gain, a really dry mouth, those are common side effects, negative side effects, and I definitely want to know about them. Especially if you seem to feel foggy in your thinking. Dr. Olson also needs to know about these things because he cares about you and you can trust him. I'll be sure to talk to Dr. Olson also around the time of that appointment to let him know what I've noticed in you and to let him know about the changes I've seen. You can always call me if you start to feel sick and have these side effects, especially if you start to feel depressed and or suicidal. It's very important and you can trust me. I want to know about that again so I can help relay that information to Dr. Olson. We don't want your depression to get worse, and we are all a team in this. Sometimes doctors have to change how much medicine a person takes and how much they give to somebody, and that is totally normal. If it's not the right medicine for you, then we don't want you to take citalopram anymore. Dr. Olson will change it. We want you to be comfortable with the kind of medication that you are taking. Sometimes people start out taking an antidepressant, and after that 1 month appointment, or even along the line, maybe a couple months from first starting to take medication, the doctor might also need to add another medication or a vitamin or something to make sure that the combination is just right for you. Again, it's kind of like an experiment. Dr. Olson is very knowledgeable and he knows the right combinations that work for people. Do you have any questions for me, Jenny, about this medication or what it does? Citalopram normally is can range between, again, 20 milligrams, which is what you're starting, and it could be prescribed up to 80 milligrams. It's very, very rare at that amount. Most people stop at 60 milligrams or 40 milligrams. Shit, stop it. I gotta cut that.